Hi, everyone, and thank you so much for joining today's webinar. The title of today's webinar is Supporting College Students with Mental Health Conditions in the Wake of COVID-19, and will be brought to you by Michelle Mullen at the University of Massachusetts Medical School Transitions to Adulthood Center for Research. Go to the next slide. So right now, I'm going to turn it over to Michelle Mullen, your lead presenter, who's going to take it away with today's agenda. And again, feel free to comment in the chat if you're having any tech issues or have any questions. Thanks again.
Thank you, Amanda. So folks, we've been told that we can't use our webcams, which is kind of odd for me. So I'm just going to turn on my cam for a second and say hi. Hi. Thank you for coming. We appreciate you and everything that you're trying to do for the students that you're supporting. And because of the lag, I'll turn myself off now, but I just wanted to say thank you for coming and that you can see my face for a second. It's weird to see a voice or to hear a voice and not a face. So today we'll talk about the changing college environment, how to identify support needs of students, and how we can creatively and remotely support the students who used to be on campus. And my focus today will really be about how these students organize themselves to finish up the rest of the semester. And so we have had a bit of a lag. I was the person that was transitioning Amanda's slide, so a bit of a lag. So this webinar is for direct service practitioners who are providing some type of support, instrumental, emotional, to college students with mental health conditions. And so largely we're focusing this on support education providers, mental health providers, accessibility or disability offices, folks who work in those offices, as well as counseling and CAPS. And largely these groups do not come together and have discussions, but we recognize that all of us are now serving the same population in a way that is largely uncoordinated. It was really heartwarming when we were looking at the questions that you guys had sent in advance about like, how do I help? We just want to help. This is like so hard for everyone. And it was really very, very sweet. And so we appreciate you. And so our focus today is how do we really provide strategic support and intentional support for students in this kind of hectic and crazy time. So you may actually be struggling with some of the same things. If your students are off campus and you live in the same area, you may not be at work either. And so working from home and kind of transitioning to a new set of expectations, hopefully you can get something from this webinar. We also want to know what are some other things that you folks need, both in content. And so you can also use the chat function to tell us if there are additional webinars that you think would be helpful for you, your staff, your students, and their families. We're open to all suggestions. So I really don't need this slide because we kind of all know this. This is an unprecedented time and everyone is in turmoil and everyone is feeling some level of vulnerability. And because we are physically distanced, we also feel socially distanced. And so with that, sometimes being able to use our typical supports and strategies are not as easy. So students with mental health conditions, and we mean all mental health conditions, we don't mean specifics, but this includes those with psychosis, bipolar, depression, anxiety. So anything that would be considered largely a mental health condition, those folks may be seen as higher psychiatric risk because of their previous mental health history, the increased social isolation, and undoubtedly, if your identity is of a college student, being able to finish this semester with such a high sense of uncertainty is very, very stressful. So you increase stress, and therefore you increase some folks' vulnerability to increased symptoms, decreased connection. And so being able to focus on how to best serve these students and help them finish school is the intention of today's discussion. So at last count, it seemed like there was 268 schools that have been closed, post-secondary institutions. There, and the last slide, you'll see a link to a USA Today article, and this fella is tracking all the schools that are closed. So if you click the certain link in the article, it'll take you to his Google Doc, which is so cool. I'm so appreciative of this guy. So over 260 something schools have been closed. There is an increased displacement of vulnerable student populations. So not only those with mental health conditions, but those with mental health conditions as well as financial, food, and housing insecure. Students have been asked to leave campus, sometimes even during their spring breaks. Because of this displacement, students do not have the access to the same type of resources that they had: libraries, study space, computers, friends, internet, like everything. For students who are commuting, some of that is not as significant of a loss, meaning you may still have a home where you lay your head at night, but there may be other losses, such as food insecurity. There's also a reduction in supports, as you guys know. If you have to then, instead of seeing people in person, you have to figure out ways to be able to provide virtual support. And then there is this assumption that students are going to be able to pick up kind of right where they left off before spring break, where they are able to attend to all of their academic needs. So there is this saying now that's kind of being circulated called panicagogy, which is a combination of panic and pedagogy. So as students were being wildly displaced, their professors were left with the task of transitioning in-class classes to online classes. So you have people who are relatively untrained, largely, for people who only did online in-person classes, to then convert the rest of the 6 weeks of classes to something that would be learnable online and interacting. And so there has been chaos on campus. So we have some suggestions, and so the intention of this webinar is really to be just try to be helpful. So just as a little background, I probably should have said this earlier. I have provided support education services, direct services to college students with mental health conditions. I've helped to develop programs, worked with disability services. Now largely developing interventions and testing those to increase academic persistence for college students with mental health conditions, and have developed an intervention that really focuses on how do we increase the academic persistence of this college population, students with mental health conditions. And in your upper right-hand corner, you'll see our little emblem. It's called HYPE. At the end, you can check out our model if you're interested. But the intention of this discussion today is to provide some suggestions that may be helpful to you. And so we'll talk after this slide about what are some of the things, how do we do a good needs assessment, how do we assess where people are, and how do we meet those basic needs, and then how do we move past just the basic needs to setting them up to finish the semester. So one of the things that we've heard a lot from the young adults that we work with is like, when things are really hard, be nice to us. It's already hard. So it's hard for you guys as practitioners. It's hard for students. So pour as much love on these students as you possibly can. Be sweet, text, be able to send messages of affirmation, normalize that it's hard. It's hard for everyone. And sometimes it's hard to be able to think how you can get through this. So if you have the ability to talk with your students, be able to articulate they've gotten through hard things before. This is not to suggest to minimize what is currently happening, because this is different. This is very different, but they have their strengths and they have their support, and like trying to figure out how you can frame these so that it feels it's chaotic and it's troubling, but in some ways like that there are some good foundations for them to lean on, even if there's not very many, being able to identify some. And I'm Italian, so sending treats go a long way. So if you can send a little treat, a little food, have virtual meetings via Zoom and send something in advance, like that sometimes goes a long way. So we want to be able to engage students as they go through this really hard time. Some of this may not be possible for some of you. We don't even know where some of our students have gone. But when you can, do the things that you can. And given the questions that you guys have already asked before this webinar, it seems like you're already thinking like that, like how can we be helpful at all? So the way that the rest of this presentation will go, and then we'll open it up for discussion, some of your questions, so please keep them coming as I'm talking. Our intention earlier was to have a webinar. We didn't think there would be so many people that would show up, so we thought that we'd be able to have this kind of like roundtable discussion. We're happy that people were interested, but that then reduced our ability to have this kind of roundtable discussion. So the way that we'll talk about how do you identify existing supports, how do you kind of bridge the gap, what should we do with some of the downtime that some people are reporting because they're not traveling, and then what are some strategies that we believe in HYPE can make the difference. So there are a lot of things that are changing, like by the minute on campus, and so if you're a campus provider, then you are probably at the pulse of this. So some schools have emergency financial aid for students who are displaced, especially lower resource students. For those of you that are supporting college students, but you are not on campus, contacting schools and finding out, looking on their websites. Schools have been like pretty transparent about the resources on their websites. You may have to do a little bit of digging to find it. But if you have existing contacts on campus, let's say you're a community support education provider, call the person that you have a good relationship with in registrar, in financial aid, in disability services, and ask, like, are there some things that you guys are providing to students? Because some students don't have the bandwidth to reach out for things at this moment. So there may be some ways that we can help in that way. Finding out if their providers and prescribers are transitioning to telehealth. For a long time, we've hit a lot of barriers related to this. So now that it's not an option for people to come in for services in lots of places, now providers and states are loosening the telehealth requirements. So for those of us on the call who are disability or accessibility service providers, thinking about getting in contact with people that have been registered but have not received services from you during the semester. These folks are displaced and they may need more assistance. For those of you that are community-based providers, figuring out of your students that are not registered, is it too late to register? Presumably it is not, but there are some things that go into registration. We in HYPE suggest that students get registered really upfront initially. So in the event that they need assistance, they have assistance. So thinking about what does accessibility and disability services are asking for right now to help students with mental health conditions. Identifying if your student is connected to a BIT, a behavioral intervention team, or a behavioral health team, depends on the campus what they're called. But if so, then these services and representatives on these teams can often find additional services or reach out to students. So really the idea now is that we're just identifying what are all the things that people have and can we put them into place so that we're acting as a group that cares for the student moving forward. So is there anything in your community that can bridge the gap? Like if someone doesn't have a computer, is your local cable provider providing free internet access for students? So this idea that students have their own computers and their own a laptop, their own computers and high-speed internet is not true for a lot of students that we serve. So being able to figure out what are the existing supports. Some things for us to consider as supporters are what are the new expectations for this semester? Is every student going to be held to the same standard as the beginning of the semester? We don't believe so. These are unprecedented times. There are some discussions among faculty that, you know what, we're looking for students to show some level of engagement, but we understand that this is a different time. So better understanding with the student about what the new expectations are. Does the school that your student is going to, do they now have a pass-fail option? Some are now doing credit, no credit. So thinking about what are the implications of taking a pass-fail, how is it different? How does it influence future goals? So people who are later in their academic trajectory, like if we have students who are in their master's or PhD, maybe the pass-fail isn't as important, or students who are in freshman year. But if there are students that want to go into a certain program and they need a certain grade, is this going to get in the way? So thinking through some of these things is important. Another thing to be considering in helping your students talk to their professors are all the assignments the same? If I don't complete some assignments, can I still pass? Or, so there are some things that we don't know. And if it was a typical semester, we can say, all right, let's look at how much this is weighted, but we don't know what the expectations look like, right? So some of the kind of rules of thumb that we used before, and thinking like, okay, how do we negotiate the semester? These are kind of it's new terrain kind of for everyone here. And as I had said earlier, another thing to consider is, do the students that you currently serve need accessibility, disability services? And are there different accommodations or assistive technology that would better suit them now from home? So, some of the standard accommodations are extended time on tests and distraction-free classroom. Well, that's going to be a very, very difficult thing to assure right now when people are, living in studios with other people or living in their car. So, or back at home with their family and their younger and older sibs. And so this is what we know to be true of a confined college campus is no longer as confined and no longer as controllable. So thinking through some of these things, if you folks are interested in any of these contents in larger webinars or discussions, please put it in the chat function. We want to be helpful to you, and we know lots of people who also want to be helpful to you. So it doesn't just have to be me talking about these things. We have lots of folks who would be interested in helping our community, and the intention of this presentation was really to kind of help the good people doing the good work. We've been there. It's hard. So if we can be helpful in any way, we want to. Some additional things that you also want to consider for some students who really either do not have the resources and you can't get the resources, and pass-fail doesn't seem like a good option, is taking an incomplete an option. Does that affect them in particular ways moving forward? Is a medical withdrawal necessary? So we think about these things, as do disability services and campus administrators, that will it affect their satisfactory academic progress? And so that means, does it affect kind of how quickly they're moving towards graduation? But I really strongly encourage folks to help their students to write emails to their professors saying, what are the new expectations, or prepare to be able to ask these questions in their remote classes now. If expectations change, then you have a better sense if you'll pass or if you'll fail, either with a grade or with pass-fail. So really thinking about how do you make these decisions, incredibly important, also incredibly stressful. So being a good resource for folks is, you are very valuable at this point. And then the last thing to consider kind of is like rolling all of these things together, which is to really act intentionally. So identify for students what are their basic and academic needs, what are the community resources and relationship I as a provider can activate to help this person, what are the resources that I can pull together for folks that meet these needs, and how is it different for each of the students that I serve. And then how do I connect students to these resources? So some folks are telling me in direct service, like, we have a lot of time now because we're not seeing anyone. But arguably, you now have to spend more time to ensure that students are not going down the road of a disastrous semester remotely. So thinking about how do we kind of keep the goal in mind and finish the semester when we also are supporting these folks remotely. So is it through Zoom? Is it through FaceTime? Is it through calls? Is it through text? Is it through all of those things? Because in the absence of really intentional services now, students will have a very, very hard time. So in HYPE, we talk a lot about preventing disruption. And so seeing the red flags. There were no red flags here. We could not see any red flags, right? So now we're reacting, which is sometimes what you do, but we also want to prevent further unraveling, right? So this, as we know, this is a hard time. For you guys thinking about yourselves, some of you are no longer going to work. You are home, working from home. I am working from home. And you have to be able to do what you are supposed to do during the workday now in your home, which is very, very, very difficult. So we are going to go over 4 kind of like big skills/strategies that I believe can help to kind of reduce the static or the noise, and some of the, hopefully a lot of the anxiety, so that students can finish the semester. So in addition to this, we're going to post some YouTube videos that you can then share with your students that we think are helpful in doing some of these things. So the 4 main strategies I want to talk about today is reducing distraction, physical organization, mental organization, and electronic organization. And my belief is that if you help students to kind of feel settled or grounded in this new terrain, that some of what they're experiencing closes out. So if you think about having 17 screens open on your computer, 1,000 PDFs on the bottom, 14 emails going, that's a lot to manage. So if we close out some of these windows and start to work at the task at hand, some things feel more contained. So that's kind of what we're going for here. If there are other things that you want information on, please, once again, put it in the chat function. So I want to start with minimizing distractions. I don't know if some of you are experiencing this as you're moving your work office spaces to home, as some of your children are no longer in school, but also at home where you're supposed to be doing home instruction with your children as you're doing your own work. Everyone is home and kind of staying at home, obviously. So the importance of minimizing distraction is incredibly important. Some of these distractions we cannot help at this point. But if we don't attend to helping a student kind of get grounded and figure out a system at home, they'll be spending a lot of time what they would consider is doing a lot of work or feeling like they're doing a lot of work, but getting very little done. So there is this idea, attention residue, which is every subsequent task to the first has less attention, like less bandwidth, right? Cognitive bandwidth than the first. So every time you're disrupted in something, whatever you start doing next has less kind of space. Another thing to keep in mind, in addition to kind of like as you go through the day, you become less and less cognitively able to attend to more and more things, is that every time you're disrupted, it takes about 23 minutes to re-immerse into an activity. And so we have to figure out for ourselves, how do we set up a space for success where we reduce the internal and external distractions? And so for college students who are living on campus, this wasn't the same thing. They had to do this too, but now they're in a different environment and may not be set up for success. Now, arguably, everyone can improve in these areas, right? So this is kind of like a continuum of skills. But if we were to help students think through this now, because now we're in the mad dash for the end of the semester, it may be helpful of reducing internal and external distractions. So we know that distracted people work faster, but they also have a higher workload, more stress, more frustration, more time pressure, and they exert more effort. So right now, because of where we are and how stressful it is, we actually don't want to increase people's stress, but rather how do we figure out a way of reducing people's stress, but having them to produce more. So reducing distractions is, I think, an important principle. It may be very, very difficult to do in this time, but thinking through how do we help students set up these kind of skills and systems and use Zoom and FaceTime to be like, okay, let's see how we like set up our office space. Like, how did you set up your space to do your work, right? So like thinking about how we can use technology to help students do these like setup systems in their homes, I think is one of the keys to being able to provide an intentional support during this time. Okay, so we're going to talk about some strategies for minimizing distractions. So at UMass, all of our staff, faculty, everyone largely, except for our hospital staff and critical services, I suppose, are now working from home. So everyone is feeling this. I think that you folks that are working from home are also feeling this, is that it's very, very hard to get things done when you're unable to go to the your workspace. And for you, it may be at work, but for a student, it may be the library or the coffee shop, which we'll get to. But so when some simple strategies is to clear off your workspace. So some students, this is true for students with learning disabilities as well as mental health conditions, is that this is not the first step. That sometimes they will just put their computer in on the table or on the coffee table or in the couch with lots of clutter and space issues, right? So there's like magazines and coffee cups. And so if we close out the clutter, if we minimize clutter, it also minimizes mental clutter. So cleaning off the space is a first thing to do, which is sometimes, like I had said, unknown. It's not an automatic thing. So we think about how do we operate for college students who now are in this kind of weird space. How do we get things done? And so all the emails and being able to kind of focus on the task at hand and minimizing what we would consider external but internal distractions. So if your email is on all the time, then you're constantly getting these distractions. And while you may not be aware of it, it disrupts what you're doing. So minimizing the email or chat functions, right? So what used to happen is that if you think about your experience at work, people would walk by your office, they would stop in, you'd have these meetings, you have this chit chat, and all that has done now is increase the frequency of the emails that you get and the text messages you get. This is the same for college students. So thinking about how do we minimize or condense the periods where students are interrupted in their tasks. Maybe it's 3 times a day. So in the morning, in the afternoon, and later in the day. For students, it may be different, but all their professors are now emailing, the campus services are emailing all the time. You now have notifications coming in from like Canvas or Blackboard or whatever learning management system, all of your app notifications. So thinking about how do we minimize technology to get things done is hard initially, but then it's liberating as you figure out, oh, this actually works. So some people turn on the out-of-office notification, and for students this may be a good idea or it may be unnecessary. It depends if they also balance work, especially work on campus. So talking to your students about that is helpful. Lots of students don't have jobs right now if they're affected on campus because many work studies are over because of this, or internship hours. So thinking through what are the implications for work. Lots of college students with mental health conditions, with or without mental health conditions, work while students. We also know that younger students, so this is not just for younger students, but it could be for any students, is that being able to silence their cell phone during work periods. This is very, very difficult for people to do initially, particularly for young adults because they are so tethered to their phone. But then trying to set up free times where they can like freely roam So it doesn't have to be restricted all the time, but identifying, and we'll talk a little bit about time and task management, about how do you set it up so that you can then like do things as you want, right? So unstructured time where you can find out what's happening in the news or completely avoid the news. So minimizing distractions is kind of a very difficult to do, especially now in transitioning times, but will be helpful in kind of reducing some of the elevated, what am I supposed to be doing? How am I supposed to be getting everything done type of feeling. So the second is physical organization and creating space and developing systems. So students have been like moving out. They're transitioning from school to some type of home, we hope. We know that some students are not. I believe it's upwards of 18% of community college students are homeless. 14% of four-year college students are considered homeless. So we know that some students are really struggling here. And so for the students who are struggling with homelessness and other types of insecurities, figuring out what those services, emergency services and stable services are for them is incredibly helpful. For students who are transitioning to some place that they can call a home, there's a big kind of shock to the system. They're also managing the transition from in-person to online classes and from paper to electronic files. So lots of students already have electronic files. Lots of students will be transitioning to electronic files. So when at home, when working from this new home, creating a new type of workspace. So if you're helping people to do this, and I would argue that you should, because what we found in our research is that students with mental health conditions struggle with organization. And if they do not have the help that they may want or may need to kind of set up a system or set up an approach at home, then they spend a lot of bandwidth, like a lot of cognitive energy and emotional energy, just trying to find things and get settled and start things. And that feels very, very disruptive. And so some of you may be thinking, well, this is going to be a very hard thing to do. It's not as hard. Students are super appreciative, particularly if they're struggling with something, for assistance. Some of you may be thinking, I don't do this. Identifying someone who could do it, or maybe you can expand your role given the circumstances and, FaceTime or Zoom with someone and say, like, okay, so let's look at the place where you're thinking about doing your work. Like, is there a way that we can set it up so that you're successful? I know that you say that you like X, Y, and Z. We can actually talk through some of the questions about what you would ask them. So starting with a clean workspace is super helpful, as I had just said. But like, some people argue with me, but I think a table is really helpful. Some students are like, I do my best work in bed. And I think, really, in bed is your best work? Like, how do you type papers really well? So some people may disagree with me, but thinking through how people work the best is incredibly important. And then figuring out, have they ever had experience with learning management systems before? And these students will struggle the most, especially those that are moving to like Canvas or moving to Zoom classrooms. If they've never used it, let's say an older student or a student that just really struggles organizationally, like how are they going to manage all of the new types of information coming in? So my argument is that physical organization, if you know where your papers are, if you know where your stuff is, that creates mental organization. You have one level of structure that helps to kind of, like we said, X out some of those 20 computer screens that you have open, closes out some of those 1,000 PDFs, and starts to make the icons on your own like cognitive computer become bigger. So when thinking about physical organization, it's really helpful to understand from the student's perspective of what do they need to do to be successful at home. So I was once a firm believer that different tasks may need different spaces, right? So sometimes you need a super quiet spot. Sometimes you need a semi-quiet, a little bit of background noise, a lot of background noise. But now we have to start thinking about how do we create those spaces at home where these different types of work can be done, because you'll still have to do your stats class at home. You still have to do your creative writing at home. Like, you literally If you're in certain places in the U.S. right now, you can't go anywhere because there's no place that's open. So you have to figure out how to do that at home. So understanding for what courses do people or under what circumstances have the best types of outcomes. So where do you write, think, study, prepare the best for, stats, psychology, writing, philosophy? So for each course, what did it look like for you? Some students will have great answers for you, some won't. And so you think like, well, then where is it the hardest to get stuff done? And you try to avoid creating a space like that. Now, you will have students that are up against real significant barriers. So if you have a working mom student who has young children in school, then you have some barriers that you can't put a 4-year-old in another room for hours to do your work, right? So these are real hardships. Thinking about what are some resources are incredibly important, but there will need to be some level of discussion with both the faculty and the school about what happens for students that have these unique set of circumstances that they don't consider when considering the traditional college student. So understanding the circumstances and the places, and then kind of figuring out, like, can we do this in your home? Is there a way? Is there a time? So I put a link here, Covidity, Covidity. I don't know, however you want to say it. It's a very cool, I can't say it so well. It's a cool website. Go to it. It has like free background noises for college students. So like university background noise, coffee shop, like it's kind of cool. So for some students that need that kind of like coffee shop background noise, there is a place where you can get that and you can import it for yourself. So thinking about like, are there artificial ways that you can create and natural ways that you can create some of the circumstances that students work better under. And then obviously, this is what I started to speak about a little bit earlier, are what about the barriers to working at home, clearly, or working from someone's car, right, if you have a student who's experiencing homelessness. So who do they live with? What gets in the way? And is it hard to start tasks? So one of the things to explore with students that you're serving is like, what's getting in the way of you starting this? And it could just be like, I don't know what I'm supposed to be doing now. All of the syllabi have changed. I don't know what I'm doing. I don't know how I'm going to get this done. I really, so there is this sense of panic, not only of professors, but for students, is like, there's not that much time left in the semester. So then if this is where we are with students, which is like, what do I have to get done to finish? Like, what are the expectations of me? Answering those questions are super important. But then thinking about like, how do we kind of blow up and start over our time and task management strategies? So right now the idea is that keeping the goal in mind, every day is going to be hectic. We're going to finish school. We're going to minimize distractions as best as we can. We're going to set you up at home to be successful as best as we can. And we're going to figure out day to day, week by week, what you have to do to get it done, right? And so students, if you're meeting the need, if those are their needs, then they will be very helpful. They also have lots of basic needs, so you have to meet those first, as we had talked about. So time management is, how much time do I have and how much time will it take to get done, right? So this is really about the time component. Task management is, what do I actually have to do and when do I have to get it done? So these are two different components that people often think are the same thing, but they're not. Sometimes, or often, it's a combination of both. And so time management, all of your students will probably be getting revised syllabi. And those revised syllabi go through very carefully to see, like, has the reduction in class participation changed? Has the number of assignments changed? Has the weighting of those assignments changed? And enter all the new assignments into a calendar. If your student does not have a calendar, right now it's even more important. There is no face-to-face time with professors. And professors do very little reminding anyway, but now given this time, you may even get less of that. Or the the upside slash downside is that you may get over communication where you can't answer all these emails. You can't read all of them. So right now we don't know how students are experiencing the professors, but as support providers, this is exactly what you can find out is, are you getting any communication from this professor? Are you getting too much here? So time management is figuring out, putting on in the calendar, what are the things that I have to get done? Like, what are the new assignments? What are the class times? Some of your students are now participating in class times in different time zones, which is a really hectic situation to think about if you consider some of these students who went from California to New York, or from Washington to Florida. I mean, these students are all over the place. So now kind of figuring out, what does the new calendar look like? If your students are not using calendars, this is an incredibly important time to start, just as a way of organizing. And then figuring out with time management and later with task management is what is negotiable and what is not. So this is a real life skill. You figure it out in college, you got that for the rest of your life. But what of these assignments need to happen on Thursday, need to happen on Friday? Some of this, professors now will probably be much more flexible than they have in the past because they also are in a very foreign situation, most of them. So I was speaking to a mentor of mine recently, and he was telling me about a person he works with that he says, if it's not in the calendar, it doesn't. And I said, it doesn't get done. He was like, even better than that. It doesn't exist. And he's totally right. If it's not in the calendar, it doesn't exist. If it's not there, you don't know that it needs to get done. If you think about, for those of you who are support providers, if I take your calendar today, you will have no idea what you're doing, perhaps later today or tomorrow. So students need to be able to rely on their calendars just the same as kind of dictating, right? We want folks to, this is a hectic time, but being able to kind of keep the goal in mind. We have 6 weeks left. Let's just get through, maybe even 5 weeks, depending on where you are. But like, be to-do list oriented, calendar oriented, right? So people say, well, how am I supposed to do this with the person that I'm serving? And so if you use Zoom, and Zoom has some free software that you can use for meetings that last 45 minutes, but you can Zoom with folks and they can show their calendar if it's paper, or you can share screen if it's electronic. If anyone needs help with some of these like technological answers, please let us know. Once again, drop it in to the chat function. But I would argue for students, especially students with mental health conditions that may be struggling with increased symptoms, lack of support, that a to-do list is even more important. And the to-do list is, what do I have to get done today? When do I have to do it? What has to get done by the end of the week? When do I have to do it? So daily and weekly to-do lists. And sometimes this is exactly what a provider can do with someone. Like, all right, so what do we have to get done today? Let's make the list for today, tomorrow, Wednesday, Thursday, Friday, for the whole week. And because sometimes time management, having these blocks that seem so permanent, is not helpful. Whereas task management is, I can move these things around as long as I know that it gets done by Wednesday, right? I can move these things around. Don't have to do it in the morning. I can do it in the evening if I want to. But being able to figure out what needs to get done and when is incredibly important, especially when people's lives feel so hectic. I only have this amount of time. What do I need to use it for? So prioritizing tasks. Now, your task management can live in your on your calendar, or it could be separate. I don't have real preferences about it. I mean, I have a personal preference, but that's my personal preference. But working with your students to figure out like what works best for you. So some people may have come to this webinar hoping to get something else. But when you ask students what they need, and people with mental health conditions about achieving their goals, it's the tactical, instrumental help. Like, how do I do this? So this is kind of how I operate, which is this is how we do this. And you do it in a partnering way. I can tell you, I am also a student, so some of this, I love this is a real experience for me right now too. Is if someone else says to me, you know what you need to do? I wrote this as like a student wants to kill you, but I want to kill someone when they say that to me. Like I'm already doing as much as I can. Like I don't have any more space for anything else, right? So this is not the reaction that we want from students, but rather like, be sweet, be kind, be gentle, which is like, let's just think about like, can I help you in any way? Maybe like I can figure out with you, like to write down like what has to get done this week so you're not missing anything, or I can help you to remind you, or that we can put it in your calendar. Like think about a way about how you and how to frame it of how you can be helpful to them. I see that you're struggling with getting these things done. Like, how can I be helpful to you? I know that some other person had told me it'd be helpful to like do a to-do list by day. However you need to frame it for your students so that they, take it, figure out that student, be kind, be sweet, but figure out a way of how to frame it so that students want to take the help. But if you frame it of like, you need to make a to-do list, not all students will respond well to that, especially when right now, like they are doing all the things that they possibly can to survive in school. So this is an example of my to-do list. It's messy, and I would never want my calendar to look like this, but I have the ability to flip a piece of paper and start again. So your to-do list can be any thought that you have. It could be the things that you have to get done. But if you have a thought and it's not related to things that you're doing, put it on the list. So if it's on the list, you're not going to forget about it. And often one of the things that we do to distract ourselves is we have an idea like, oh, I have to email this person. And we stop doing the task that we're doing and we go and send that email. Now, remember what we had talked about early about attention. Then it takes you a long time to get back to that original task. If you just plop it down on the email, you're not being as distracted. You pop down the email on the to-do list, you're not being as distracted. So as a way of kind of like containing yourself and providing structure is using these things to leverage productivity. It also helps you feel more organized, which also helps to reduce anxiety and kind of like spinning your wheels. So electronic organization, some students will need zero help here. Zero. They can teach you a thing or two. Other students will be wildly disorganized, particularly if they're being oriented to a new learning management system, or if their professors are wildly unorganized. And let me tell you that professors are, lots of them are wildly disorganized. So then students aren't working with like great templates either, right? So figuring out how do they download the files that are either being emailed sporadically throughout the day or being uploaded on their LMS. So LMS, once again, stands for Learning Management System, and that's kind of like the online platform that students learn from these days. So do they download them right away? Does everything get saved to the desktop? Are they using a tree system, meaning like this is the name of the course, and in the course there's course readings, course assignments, like discussion board posts, and in those folders then are they, so if you start to think about a tree of files, is that helpful for the student? So thinking about just these basic strategies help students a lot. And thinking about how do I send these things, what version was I working on. So being able to kind of create these automatic places. So when students go into their email, they have a system of like, all right, I download all, I label them here, I put them there, and that's where they stay. As compared to a student that constantly has to go back to their email and find the email with the attachment and then just only look at the attachment or start filling in answers in a document that then gets saved in the temporary file. They close it out and then they can't find it again. So these are the types of things that spin students' wheels, that make them feel like this is something that I cannot get done. So if we take a little time to think about like, all right, this is crazy town, everything is super hectic. How do we get set up so that you're feeling good and there are little things that get in the way for everyone. So any way that you can frame it so you can get your grubby little paws through Zoom to help students is a way that may be helpful to a lot of your students. Like I said, some students won't struggle with this at all. But given our research on organization and executive functioning skills, students with mental health conditions struggle the most with this. And an older study that we had done, when we asked students what were the top things that they struggled with that got in the way of completing their classes and their coursework, and executive functioning skills like prioritizing tasks and time management, task management, stamina, that all trumps what we would consider classic mental health symptoms. So students know that they struggle with this. So being able to help them in any way is probably one of the best things that you can do during this time of uncertainty, in addition to helping with kind of like the basic needs. So my last note for today, and then we'll kind of move to questions. So for those of you who are still interested, plop them in. My last tip for today will be about one of my preferred apps for class organization, which is Notability. So lots of your students will be attending classes online. Some of them will be recorded, some will not. Notability is an app. It's like of low cost, between $5 and $10. It can be used on a laptop, on a desktop, on a PC, on Apple, on tablets, on phones, and you can upload PowerPoint, PDFs, and you can record classes and sync the audio with your note-taking. So if your professor sends you out a slide deck, you can upload it to Notability, turn it on, write notes in their PowerPoint slide deck while syncing with the professor's audio. So what you then have is, if you get to a place where you get distracted because your dog pees on the floor, or your kid comes into the room, or you get a phone call from emergency financial aid, you can answer those things. And when you come back, you can write rewind. And then when you go to review your notes, you literally just click that word rewind, and it'll sync you to where you wrote that word in that day's lecture. So you don't have to listen to 3 hours again. You rewind until you get to the part where you kind of like either got distracted or walked away, and then you take notes there. This allows you to strategically think about your courses. You don't have to play all of them over again, but go to the spots where you that you didn't take great notes or you weren't paying attention. In my opinion, this is pretty amazing. You can then upload them. Everything can be placed in a place. You can upload them to your desktop if you want. You can create files in Notability. So anyway, one of my favorite things, if you can encourage students to use this, it may be helpful, especially with the reduced ability to be attending to all classes online, which is also hard to do, but just as a note. So with that, I'm going to transition to question and answer. So Debbie's working her magic right now, calling some of your questions that you've been asking. So our website is here, which is the umassmed.edu/hype, are also our larger transitions ACR center is here as well. Please direct any questions that you have to us at hype@umassmed.edu. So here we are. So Debbie, if you can unmute yourself, I hope that we have some questions that I can be helpful in answering.
We do indeed. Hi, everyone.
Great.
I'm Nicole Ellis. And thank you, Michelle, for a super informative and timely webinar. I thought we might start the questions with this one, and that is, how often should we try to be in contact with students during this time?
Oh, that's a really good question. So it's a hard question. And I would say check in with your folks. People who respond, ask them what they need, set up a time to meet via Zoom if you can, so you can see their face. We have been told by young adults that if we don't tell you to stop texting us, continue to do so because it's helpful. don't make it hard to come back to services. So if you have students that you can't find or are not responding, continue to check in. Hey, thinking about you, just thinking about how this may be helpful. I'm going to send you this resource. Be encouraging, be sweet, be engaging so that they come back. Our purpose is actually to help people. And so sometimes when we're ready to help, they're not ready to take it, but we want to encourage them to come back at any time. So thinking about that, I would say don't do it so frequently that you become annoying, but that's a hard line too. So we're of the mind of initially you may want to reach out a couple of times the first couple of weeks, saying like, hey, I just thought about you. I saw that this class came back online today, or just checking in that you were able to get your stuff out of your room. Any way that you can engage them is helpful. But I would say don't stop periodically reaching out over time, because it may just be at that right time that you get them. So if you text, I would encourage texting. Google Voice helps you to text and not use your own personal cell phone. So if there are some issues related to text in your own personal cell phone, students get emails. They don't really respond to emails, but we think that killing them with kindness in any way that you can, and trying to re-engage is super helpful. So thanks for that question. It's not an easy answer, but be kind. Don't make it hard for them to come back to services, and be encouraging. So those were some of the messages that young adults had taught us. Go ahead, Debbie. Next question.
That's great. So we had another question come in about special advice that you would have for disability service coaches who are working as the new quarter starts.
Yeah. Oh, sweet. It's a hard time. So for those of us that are in quarter systems, trimesters, it's, all these semesters or all of these terms are going to kind of blend in. Everyone's going to be affected. But I think talking a lot about some of the questions that we had asked earlier about and you can frame it as the condition themselves, or just generally, because I know that within disability services, you kind of have to frame like, how does your condition affect your ability to do this? And then I would say in your home for these types of courses, and figure out, are there different types of apps that would work for these students? Are there some special accommodations? So, it's not a very popular accommodation, but it may, in these times, actually be more, we may want to consider more carefully if a reduced course accommodation is applicable for students with certain types of mental health conditions working from home. And so for those of you that are supporters, this would be, instead of 12 credits to be considered full-time, 9 credits may be considered full-time to be able to manage. Disability is when the environment, right, it's environment induced. So if you are working from home as a forced choice, you're not enrolling in an online class, but if you intended to take in-person classes to do these things, but now you have to take an online course, is it reasonable that a reduction in the number of courses is reasonable, because now you're dealing with different types of environments? I think this accommodations in this environment is particularly difficult because you don't have those controls like you used to have. So thinking about like, what does time and a half look like? What does a distraction-free course exam look like? These are all very different things. What does a note taker look like? So I think that these are hard times. And if people are interested in thinking about these things, we are welcome to have, I'm interested in having these discussions, because students often don't know what to ask for. So if disability service coaches are having a hard time thinking about options, students certainly aren't going to be saying like, I think I really need this. So as a community of thinking through like, what do reasonable accommodations look like during COVID, I think is a legitimate use of people's time. And it's we're all in very, very difficult situations. So I appreciate that question.
That's great, Michelle. We had another one during registration that I bet a lot of people are thinking about. and that is how to work with students who see all these changes happening and immediately drop out without seeking support. When is school much? How do we help students decide when their mental health is more important than staying in class?
Yeah, so I think that's a really good question. And one of the things I think that we have, which is different at different times, is time is actually on our side with this, meaning that faculty are being much more flexible. So this idea of all classes not being penalized as pass-fail, like not held against you, and that you don't have to decide into the middle of April, is a signaling from the school saying, like, we know that this is hectic. We know that this is hard. So for the students that you have contact with, I would encourage you to encourage them to hold tight for a couple weeks to see if we can kind of figure this out. Like, let's figure out like what faculty actually want. Like, what are your professors actually going to ask for you to do? Like, will they actually be grading according to the rubric, right? Being able to say to students, like, you're struggling, everyone's struggling. If this is too hard, it's too hard. What would be great is if we could figure out a way of helping you get the things that you need and figuring out if we can stay in the classes for this semester. I think that some students sometimes throw up their hands because it feels too hard. And this, I think, is where strategic supports come in, which is like, let me hold that for you, right? So the good thing is that everyone is in chaos. You're not the only one feeling like this. So kind of like legitimizing that this is hard for everyone. And knowing that you can take incompletes or you can take pass fails really far into the semester where otherwise it wouldn't be granted is signaling. And so if you can, I wouldn't say convince. Some students will be convinced when they come to see you. But there is a framing here, which is faculty don't want to be penalizing students for things that are outside of their own control. And if there's a way of saving this semester that does not put you at greater risk, then why do it? Like, right? So we don't want to make people feel any worse or increase anyone's symptoms. But if there's a way that we can just ride this out and take the next 2 weeks to assess, then we can kind of determine if this makes sense for you once you know what the expectations are. Students are in lots of places just coming back to school this week, and it's chaos, literally chaos. So I appreciate that question. People are going to be struggling all over, and to the benefit of a college student with mental health conditions, entire classes are going to be struggling. They're not going to be the only ones feeling like this, right? It's like a kind of a universal experience of college students. And for those of us that have served this population for a long time, it's actually a nice balancing, which is like, we're not the ones having to figure out how do you frame these questions and how do you ask these things that other students may not be asking. Because right now, everyone wants to know, is this going to be graded hard? Like, do I have to hand this in? Like, can I have an extension? Is this flexible? Or are you going to be dropping some assignments? Right, all these questions that go through students' minds when they have increased symptoms or when the stress becomes too high and they don't have adequate symptoms. Now everyone's going to be asking, with or without mental health conditions. So my advice to students or supporters of students that are thinking, I'm just going to drop now and kind of cut the loss, is to think like, we have a handful of weeks left. If we can save it, let's save it, but not at the cost of your mental health. But if there's ways that we can do that, then let's kind of like listen closely to what our faculty and schools have to say for the next couple of weeks. I think right now we're all struggling with, we don't really know. Every day the college campus changes, and so does our country. So I think we're all kind of, as a community, trying to figure this out together. But I think being flexible, being responsive, and being aware are the things that, as providers, we can be super intentional in. I don't know if that's helpful, but Debbie, if there's another question or if you have a follow-up, yeah.
There are, and this is actually somewhat related to what you were just saying, and somebody here had a question about what to tell a student whose instructor is not updating the course calendar or the syllabus, how to work with that situation.
Yeah. Well, I think this is good. So there are a couple of things I think that we have to be mindful of is faculty are being thrust into a different learning environment too. And so they may be very late. But what I would also say is document, document, document. So help the student write an email that is nice. I know this is really hard for you guys, and most people are focusing on the implications of students, and it is really hard for us too. But given our kind of given everything that's changing, do you know when you'll have the updated syllabus? And do you have a sense of when you'll have X, Y, and Z, right? And so being able to send those emails to your professor with or without a response, then documents to other people later, like the dean, should the tides not be in your favor later, right? So I think there are a certain set of skills that we can teach students, which is, what's the saying about vinegar and bees? It's something like bees are...
You catch more flies with honey than vinegar.
Yes. So being able to figure out how do you give feedback to your professor, prompting them what you need in a way that they want to respond to you, is that the skill. Also is documenting so that you can make your case to someone else for an appeal. So my feeling, and now don't go by my feeling because it's just mine, but my feeling is that we will see an amazing amount of flexibility for all students during this time. What I would encourage is for your students not to fall off the radar, however, and show back up at the last day without submitting anything for the last 6 weeks. That will not be seen kindly by professors. So early and often communication, be kind. That's a skill set to get what you need, and then documenting. So I think that it is hard for students, but that they should not be quiet. So if that email goes unanswered, then later in the week or at the top of the next week, say, hey, I know this is a busy time for you, just following up. Below is the email that I sent about the changing course curriculum. Now, I have helped to craft lots of emails like this for students that I serve. They take a first draft, they pass it to me, and I say, oh, you may want to consider saying this. Or I say out loud the things I just said to you, and then they kind of put their own spin on it. So this is a way that we can actually help students to develop really good skills, not only for school, but for work and their own personal life. But here, the squeaky wheel will get the oil. I think that you guys are learning them. Not very good with sayings, so I should probably stop trying to use them, but I won't. But really encourage that skill development and advocating for students when it seems to be your position. Maybe it's 3:12. Maybe we have time for one more question, if I could, or two, if I can answer closely.
Yeah. A lot of people have asked about how to support students with social isolation.
Yeah.
And international students who are far from home, who are experiencing a certain kind of that. Yeah.
Yeah. So I think this is really hard. And I know that there's some really good work now being done by other groups, including ours, but other groups on social connectedness during this time. And we can post some resources for this too. But some students are doing virtual study groups. So getting their own Zoom lines. They're free right now. And people just calling in and being quiet and working together. There are new apps. But I think it's like setting up, how do you recreate your social circle in times like this? I then think that, and to those people, that may be a little work on the provider's part, which is like, oh, when did you guys get together before? Maybe you can do like virtual coffee, or maybe you can do like, happy hour, virtual happy hour, or, family dinners, right? So there are those components that you can be like thoughtful about. There are others of students that were like not very connected interpersonally, but reliant on the social connectedness of their university. So like they didn't have a lot of friends, but they would go to the student center and, be around other people and have lunch, or being able to see the other guy from, that class, and they would kind of, say hi or whatever. So I think there we have this different situation where students that aren't terribly connected interpersonally, so someone that can't just say like, oh, sign on to Zoom now and we can do our math work together. But really we're reliant on the informal, and passerby kind of connections. And I think that is the one that's more difficult to do. And I think our campus folks may be able to add to this to see if they're trying to host the virtual Wopon, lunch hour. So some schools are doing more innovative things to help people stay connected, so people can just Zoom into a line and kind of have people around, which is kind of a cool idea. But I think that it is very, very hard at a time where everyone is mandated to stay inside, to identify for a student that is socially isolated, how do you become more connected? There's another sister group of ours. It's the Temple University Collaborative for Community Inclusion, run by Mark Salzer. And he had done a webinar today too on community inclusion during COVID. So after this webinar, you guys may want to go check out what they're doing at their center. That's Salzer, Salzer, at Temple University's Collaborative for Community Inclusion. So they may have some really good resources too. And once again, we're trying to kind of pack our resource list with those things that would be helpful for you guys. The only other thing that I can think about is if you are providers, asking college students that you're serving if you can host a virtual social hour. So every day at these times, Boston University, and we'll be posting this too, Nateo program has free kind of web-based activities that people can join, like Sports Center, where people come together and just talk about, which is kind of funny to think about because there are no sports right now, but thinking about these things. But those are some examples. So if you want to go check out Boston University's Nateo, NITEO, it's in the Center for Psych Rehab. So if you Google search those three things, but we'll also be sending out a link to their virtual workshops. But there are some things that you can do and try to do on your own. And then there's other things that you can try to connect people to. But you folks are doing amazing things, and it's incredibly hard. And right now it's really about how can we be super flexible, super responsive, and be intentional in a way that is helpful to our students, keeping the students where they are with minimizing the amount of stress, knowing that this is stressful for all students, and helping students to make good decisions of, can I ride out the next couple of weeks, or is it too much? And if it's too much, am I taking an incomplete? Am I taking a medical withdrawal? What am I doing? And if we can be helpful to you at all, we're happy to do that. So hopefully you can load in the chat function of things that you need. We recognize for your friends and colleagues, if they weren't able to do this, that we'll be hosting another discussion hour for the attendees that have not been able to participate today. But perhaps we can also send out that subsequent Q&A to the email that we're sending out with these materials for you guys too. So I appreciate it, your time. I want to say that we appreciate the good work that you're doing, and I hope that you're all staying safe and healthy and staying connected, physically distancing, but socially staying connected is a very hard thing to do. If we can be helpful in any way, please let us know. And I know that we're a little over time, so I don't know if Debbie or Amanda, if you needed to say anything else before we wrapped up.
No, but thank you, Michelle. That was wonderful. And we have lots of great questions that we can follow up on during a part 2.
Great. Well, thank you guys for coming. We appreciate you. And please let us know how we can be helpful. Take care.